Welcome back to The Explainer. Today, we're unpacking a real-life, locked-room medical mystery, and this one unfolded right in the middle of the ocean. Imagine being on a cruise ship isolated by thousands of miles of water, suddenly dealing with a deadly viral outbreak. Panic actually spread among the cruise ship passengers immediately after an American traveler tested positive, and then, one by one, people began falling ill with a really severe respiratory disease. That is exactly what happened aboard the MV Hondius in the spring of 2026. 3 deaths, 11 illnesses, and a grueling 42 days of strict biocontainment quarantine. I mean, these numbers sound like they're straight out of a sci-fi thriller, right? But they are the very grim reality of this outbreak. Authorities quickly responded by flying exposed passengers to a special quarantine center just to prevent further spread of the virus. So what kind of pathogen causes a drastic response like that? And how did authorities manage the panic? Let's dive in. Starting with Section 1, Outbreak on the Ocean. Let's look at the timeline, because this escalated incredibly fast. On April 1st, the MV Hondius, which is an expedition vessel, departs from Argentina. But just 10 days later, on April 11th, tragedy strikes. A Dutch passenger passes away. Fast forward a bit to May 2nd, a third fatality occurs on the ship, and the European Center for Disease Prevention and Control gets officially notified of a cluster of severe respiratory illnesses. By May 10th, the situation is deemed so dangerous that exposed Americans are evacuated from the Canary Islands directly to a specialized biocontainment unit in Nebraska to prevent any further spread. Looking at how rapidly this all went down, we have to ask ourselves, what exactly is happening here? How does a high-end luxury expedition turn into an international bioemergency, complete with specialized isolation units? To answer that, we really need to pivot from the human drama to the hard science. Let's move to Section 2, Meet the Andes virus. So our biological culprit here is the Andes hantavirus. Now, experts say hantavirus is a rare but dangerous disease that can spread from rodents to humans. Specifically, this Andes variant is primarily carried by the long-tailed pygmy rice rat, which is native to parts of South America like Argentina and Chile. Typically, humans get infected by breathing in aerosols, basically just disturbed dust, that contains rodent saliva, urine, or droppings. And the result? It can lead to a really severe lung condition called hantavirus pulmonary syndrome, or HPS, where the lungs rapidly fill with fluid. But here is where things get truly wild. Most hantaviruses, they only spread from rodents to humans. It's a dead end. Once a human has it, the chain of transmission stops. But the Andes hantavirus is completely unique. It is literally the only hantavirus known to also spread from person to person. It transmits through direct contact, saliva, and airborne droplets. I mean, put that rare capability into the dense, highly shared environment of a cruise ship where everyone is dining and mingling together, you've got the absolute perfect storm for a viral cluster. 40%. That is the estimated case fatality rate for Hondius virus infections. Think about that for a second. 4 out of 10 people who contract it do not survive. There's currently no specific antiviral treatment and no vaccine available. The main treatment is really just supportive care, like providing oxygen. And this incredibly severe mortality risk is exactly why health officials were on such high alert and triggered that extreme emergency evacuation protocol for the passengers. Which brings us to the response in Section 3, the 42-day quarantine. Let's humanize this clinical data for a second because it's wild. Jake Rosemarin, a 30-year-old American passenger who was evacuated to the University of Nebraska Medical Center, noted from his isolation room, "I already ordered a mattress pad, new pillows. I think for now my plan is to take it one day at a time." It is just a completely surreal situation. He was supposed to be looking at penguins in the South Atlantic. Instead, he's sitting in a highly specialized hospital room, getting iced horchatas from nurses in full protective gear, just running down the clock to see if he develops a deadly illness. But why 42 days? Well, the biological necessity behind that grueling timeline all comes down to the incubation period for the Andes virus. The time between being exposed and actually showing symptoms can be up to 6 full weeks. So health officials are closely monitoring the situation while medical screenings of passengers continue for that entire duration. Monitored at top-tier facilities like those biocontainment units in Nebraska and Emory, the biosecurity is locked down tight. Absolutely no visitors, full PPE for all medical staff. They have to rely on symptom-based surveillance to immediately isolate anyone who begins to show signs of illness during that massive waiting period. Okay, let's dive into the math behind this. Section 4, Modeling the Hidden Spread. A basic reproduction number of 2.76. A recent mathematical modeling study published on medRxiv actually analyzed this exact cruise ship outbreak. They calculated the basic reproduction number, or R0, before strict quarantine measures were put in place, to be 2.76. Basically, that means one infected person on board was likely to infect nearly 3 others. In a confined, densely populated space like a ship, a transmission rate that high absolutely guarantees sustained onboard spread unless you lock everything down immediately. And honestly, the scariest part of that mathematical model is the huge gap between identified cases and active exposed cases. Because of that massive 6-week incubation period we just talked about, there is a dangerous disconnect between people who are infected and people who actually look sick. The study's simulations suggest that several exposed individuals likely remained completely unidentified during the early phase of the outbreak. This proves exactly why health officials couldn't just, screen passengers for a fever at the airport and send them home. They had to assume a hidden reservoir of exposed cases existed, which made that 42-day quarantine absolutely vital to stop the virus from getting into the wider community. Now zoom out with me for a second. Section 5. Assessing the global risk. After all those terrifying statistics, I do have some much-needed reassurance for you. According to the CDC, the ECDC, and the World Health Organization, the risk to the general global public remains very low. Despite American passengers returning home, there have been 0 confirmed secondary cases spreading in the U.S. from this outbreak yet. In fact, the WHO Director General stated it plainly. This is not another COVID. And why is that? Well, because while the Andes virus can spread person to person, sustained transmission typically requires prolonged close contact. We're talking living in the same cabin or household, sharing meals, breathing the exact same air for extended periods. It is really not something you're likely to catch just walking past someone on the street. So the swift isolation of the MV Hondius passengers shows our public health systems working exactly as they should to contain a localized, highly dangerous threat. But it also serves as a stark warning, doesn't it? As our world becomes more connected, are our global health systems truly ready for the next biological stress test? This hantavirus outbreak was a serious near miss that required extreme, rapid global coordination and massive quarantine infrastructure. It definitely leaves us wondering what happens when the next pathogen isn't quite so contained. Thanks for joining me on The Explainer today. Keep learning and stay curious.